welcome everybody to FCS Connect. It's really exciting that, to see everyone, to hear about what's going on in your neck of the woods. I am a little jealous of people who have snow. I'd like to have just a little bit of it here in East Tennessee, but we're glad you're here, we're glad you're warm, and we will move right along today. So, to get us started, I'd like for you to do something for me. In the text chat, answer this question. Thus far, what have you enjoyed about FCS Connect? So drop that into the text chat. If you've not enjoyed anything, make something up. So tell us, what have you enjoyed? Seeing everyone, seeing colleagues, seeing faces. Yes, seeing faces. Learning about others. I agree too, Shelley. It's been good to catch up, especially during this time. Seeing everyone, learning updates, learning about some of the different programs that you weren't familiar with. Good job, Sarah, Ransom. We got lots of seeing and getting updates. Thanks, Patsy, to hear from the colleagues and specialists. And good content. Thank you, Sarah Poole. Thanks, Janet. Feels a bit of a void for not being in person. Good, y'all. Well, we are glad you're enjoying it. I can tell you from a specialist perspective, I am, and I know some of my colleagues are enjoying it as well, that we actually get to see you all, especially in this time of being apart. Oh, good. Thank you, Megan. Right, you all. This is awesome. I'm glad to see that you all are enjoying our time together. So, today we have someone special with us. We're really excited to welcome as our first mini speaker, Dr. Fox. As you all know, Dr. Fox is our new Assistant Dean for Family and Consumer Sciences and our Department Head of Family and Consumer Sciences. Dr. Fox, I'm going to turn it over to you. I believe that you have some welcome and greetings for us, and then an activity that you want us to do.
Well, it is indeed a pleasure for me to be here. And as I said in my response, getting to identify names and faces and putting together and learning just a little bit more about you. And so I am, as I start my tenure at University of Tennessee with Family Consumer Sciences, I definitely are going to be listening, learning, and leading in these first 100 days. And so as part of the listening, I wanted to provide an avenue for you to provide some input for me. So in the chat, as well as on the screen, there's a Menti poll, and go to www.menti.com. And this shouldn't be anything that you haven't already done, but I have 2 open-ended questions that I want you to just respond to. And I will share the screen now so you can see people's responses if anybody has responded. There we go. And so the first question that we start with is, what are the most important FCS organizational priorities? And I'm sorry to hit you really seriously on this morning, and some of you might be in snow fog right now or without electricity, but I wanted to ask you kind of what your priorities are. You have 3 responses, so you can answer it 3 times. It could be programmatic, it could be organizational, etc. So just tell me what you think. We're off to a great start. Oh, we have 3. And I'm going to wait and not talk and let y'all fill in until we reach about halfway point at least. And then we'll go to the second question. And I promise the second question I think is a little bit easier. As those of you that have taken Menti polls will know, the themes that are large are the ones that have had the most responses. Interesting responses as well. Marketing definitely is up there. Technology. And if anyone would like to explain, so I'm collecting this data, and hopefully we'll be able to send it out in some kind of a poll so we can prioritize what just this brainstorming session But if you have specific ideas, please share those in the chat, because I think we're all stronger together when we create synergy. So go ahead, and if you feel comfortable, go ahead and provide your ideas in the chat, or even constructive suggestions. That would be fine as well. Okay, so we have about 55 people. You can continue to answer this question, but I think we're about at over the halfway point. And I really want to honor the speakers today by not taking up a lot of their time. But thank you. Continue those responses, and then we'll go to the next area. Oh, we have more, so thank you for continuing that.
Dr. Fox, one of the comments in chat has been a priority is a more formal way to collaborate with other counties on projects and programs.
Oh, neat. That is great. Okay, we're going to go to and this could be seen as a little bit of the same question, but let's go ahead, and I'm going to present this next question. So it's good. Y'all have definitely added some more. There we go. Can you see the second slide? Yes, thank you. So where can the FCS program be enhanced? And again, I'd invite you to share comments in the poll, in the chat if you have any ideas. So we'll just take a couple minutes. I appreciate this time that the FCS Connect leaders have given me. So technology is coming out, some online technology marketing, collaboration, virtually, visibility, communication, quality evaluation, partnerships. So these are some of the areas that are showing up again. I'll just turn the program back over to our leaders in Chris and Lisa, so we can have the program of the hour. I do appreciate the opportunity. Please continue to put impact in, and if anyone would like for me to share these slides, I'd be glad to. I'm going to stop sharing at this moment and transition back to our organizers.
Thank you, Dr. Fox. I know everyone agrees with me when I say that we are so glad to have you on board. And welcome to Tennessee. It's a pleasure to have you here and to leading this great group of people.
Thank you.
All right, can everyone see my screen again? Make sure everybody can see the large version of my screen. So pleased to welcome two of our faculty from the department, Dr. Washburn and Dr. Jarvandi, and they will be talking with us about connecting community and health. And I will be driving the slide set, so if you all just let me know when you need me to transition, and we're going to let you all take it away.
Thanks, Chris. Good morning, everybody. Dr. Jarvandi and I are going to be talking about connecting community and health in some very general terms today. And I want to start with giving us a reminder of where the point we have come to. So if you'll go to the next slide. In 2014, the Cooperative Extension System put together the National Framework for Health and Wellness. And so that was the first time that we had had a document providing guidance and direction for what we do with extension health specifically. And there's one statement in that document that's been shared widely and that really stands out for me. So if you think back to history of extension, the land grant system, and the era that our organization was born from, it says that the extension model arose at a time when American agriculture was largely inefficient and only marginally productive. And what extension did is to make that system without equal in contributing to a growing world population. And so we are operating with the belief that the same system of extension can do for the nation's health what it did for American agriculture 100 years ago. But that means also that we have to look at the methods that we're using to help improve health for individuals and for communities. And so we want to delve into a little bit of how community is defined and what does our work look like within that context. So next slide, please. So you all have probably seen this model. It's a social ecological model. This is the foundation for our work in family and consumer sciences. And as a quick review, this model says that we as individuals are impacted by the families, organizations, and communities we operate within, but we also impact those families and organizations and communities. So we have a bidirectional influence. We all are part of this same grouping of people and have spheres of influence that are important for ourselves and people in our lives. So one level of this is community, and you might notice that the individual level is several layers removed from that. We tend to operate within the individual sphere in our extension programs, or maybe we operate within the family sphere. But it's only been in the last 10 years or so that we've really started to focus more on organizations, communities, and we know that there's a public value to the work that we do and that we do influence broader society. But it can be hard for us sometimes to pinpoint exactly how we do that and then to take that back to our program planning. It can also be difficult to conceptualize this because of some terminology that we use that we've adopted from other disciplines. So before we move on from this, I just want to specify that how we define community varies. So we may think of community in terms of geography, like the city limits. It could be a neighborhood. It could also be setting specific. So a church or your 4-H clubs or your FCE community. So we define community in differing terms, and we don't have to think it's big and giant and involves like a municipality or boundary markers. It can be small. So next slide. So I mentioned a little bit about the terminology that we're using being a stumbling block sometimes. You've heard of PSE, Policy Systems and Environmental Change. And important to note here is that these are changes to the social environment and also changes to the physical environment. PSE terminology, I think, it was informed by public health approaches. But if you talk to people in public health and you say PSE, they don't know what you mean. You have to explain yourself. So PSE is a term that arose somewhere not in public health and may have come from the federal levels within extension to apply to specific programs, because we've been doing PSE as a part of SNAP-Ed for quite a while. And we may, you guys at the county level may think of PSE as being confined to SNAP-Ed, but this is really something that permeates all of the levels of the work that we do in all of our knowledge areas. So next slide. So sometimes we talk about PSE and it seems really abstract, and I think that part of that is a failure of people in roles like mine to extensionize these concepts. So we've depended on public health approaches, and then we've just adopted that terminology without really thinking about how we integrate that within the work that you're already doing, because you are already doing the work. So what I want to offer to you today is an example of how we integrate program and PSE so that they aren't operating distinctly and separately, but that they are complements to each other. So one of the ways that we can think about that is we have a new or an existing program, and then we expand that to include a PSE component. And then I want to backtrack on one other thing about PSE before I move on, and that is that PSE is conducted in collaboration with others. So even if it's just the setting that you're working within, this is not something that extension does by itself or that you do by yourself. You can do it by yourself, but we don't need to do it by ourselves because it's a really collaborative process. We need ownership from the people who are impacted by these changes. So we can expand an existing program or a new one to include a PSE change component, and it can be tiny. It doesn't have to be grand and result in the passing of an ordinance or a resolution. So we can think of it in this way on the left-hand part of the screen, or we can think of it as being a little more complex if you'll advance the animation, Dr. Sneed. Sometimes we work with coalitions, and you've got that box right there. You can think of that as any decision-making group that you work with. It could be an advisory committee. It might be a foundation board. It could be your county ag committee. Any group that is able to impact both program and your PSE change approaches in your communities. Sometimes these changes are born out of a program. Sometimes we do programs to educate our decision makers, and then that leads to PSE change. It can happen lots of different ways. There is not a one size fits all. So next slide. And I've got a little bit of animation here. You can go ahead and advance it. I think we need 2 clicks. So sometimes we think of taking program to PSE, but we shouldn't think of it as needing to bridge a gap, because the PSE part is the gap fill. It's not a place we're trying to get to. It is part of what we are already doing, if we are able to think of it that way. So I want to share with you an example on the next slide. And sometimes we worry about PSE being controversial because it's got the word policy in it, and that makes us think of advocacy and lobbying. And and there are things that we have to be really careful of with the type of work that we do. But sugary beverage consumption should not be a controversial issue, right? Except that sometimes it is, because we might function in environments where there are contracts and that there is money that is being paid because of specific contracts with beverage companies. So we know that people need to reduce sugary beverage consumption, but it's not as easy as educating people on the changes that they need to make. So let's share, for an example, starting with education, how we might change the decision-making choices of a group of teenagers. So on our next slide, you will see, let's do one more. Several years ago, this is an example. This is my stepdaughter. This is about 4 years old, and she'd probably be horrified if she knew that I was showing this. She's 19 now, but this is a picture from a cruise ship, a trip we went on a while back. And so back when we were in Arkansas, she was a cheerleader, and we would go to her high school football games. And we would watch her team cheer, and they would get a break, and they would go to the concession stand. They were thirsty, and they would come back with Sprite and Coke. I mean, not even like Gatorade or something. It was all sugary beverages. And so I had a conversation with her and her friend about, do you guys have water at your concession stand? And they just had a severe, not preferring water, a severe distaste for water. Like, they did not want to drink water. They said it was really gross. So that got me thinking about how would we change those beverage consumption habits to get a group like that to drink more water? And then I realized that there are some significant barriers. So if you advance to the next slide, this group of folks spends a lot of time in school settings. Pre-COVID, we spent a lot of time in school settings. And so water access in those settings would be really critical to changing behavior of that group. But there's some barriers that go along with that. People don't like to drink out of water fountains, these traditional types of water fountains, because they're uncomfortable. Sometimes they're also kind of gross. So I had a water fountain like this at my school growing up, and that's not something that was going to motivate me to change my behavior. There are also other factors at play, if we look at this next slide, that make drinking from a fountain undesirable. So if you'll click one more time, Dr. Sneed, this was an actual water fountain that I took a picture of it because I thought it was so interesting that there was a wall instruction to not spit your smokeless tobacco in the fountain, because that means that it had happened previously, or else there would be no need for this sign. So if this is the type of environment that our kids are operating in, and then we're telling them through education, you need to drink more water, then our message is likely to fall flat. And you cannot blame them for making the decision that they do, because the environment is not set up to be supportive of them making great beverage decisions. So I've got one more example of a barrier, and then we'll talk about environmental change. If you are a high school kid and you have to bend over to drink water out of a fountain, your backpack is falling off, your purse is grazing the floor, this is uncomfortable. So we need other solutions, and those water refill stations have provided a really good one. So I know a lot of you have worked in your communities with your health councils and other groups who've gotten these built environment grants and have put a lot of water refill stations in school settings in Tennessee. And I think that's great because that is a pairing of education. You know, we go in and we do these programs about increasing your water consumption and decreasing sugary beverages. But if we had done that alone without any changes to the environment, we know that it's not enough. And that's true of most of the behavior changes that we're trying to influence people to make. So education isn't enough. We know that environmental change itself may not be enough. If these water refill stations had just started popping up in schools, they would have been a novelty, but they might not have been enough on their own without some education to influence people to use them. But we also know that sometimes there are policies that aren't supportive of those changes. So if we can do education and environment, it's good. But what about if the school has a policy that you can't take water bottles into the classroom? Well, that's going to inhibit the beverage consumption, those behavior changes we want. So a policy change paired with a supportive environment in education is really the best approach so that we can make a difference. So next slide, please. And then you can skip through this one to the next one. So we are making some really great progress in these areas. And I know that you can think of examples in your counties that are showing that. And maybe it's a small setting, maybe it's a church and they passed a water pitcher policy. But sometimes we have to look inside our own house. And the bad news is that we have a lot of room for improvement within our own organization. And you play a role in making those decisions. So let me share with you a couple of examples. This picture is from a 4-H camp where I was invited to do a program because it was a healthy living focused 4-H camp. And the thing that really stands out on this table is that all of these kids have full-size cans of sugary beverages. And so I ate lunch with them that day, and I don't drink any of the things that are on that table. So I was asking where I might be able to find some water. I had gone through the line last. So all these kids already had their food because I thought surely they've got some water around here. Well, they did. It was in the refrigerator. It was not in the location of the food that these children picked up. They had an ice chest with these beverages and a sandwich line, and then way in the kitchen there was a refrigerator where the water was kept because they wanted to get it cold. Well, that is an environment that makes the healthy choice not the easy choice because you really have to work hard to get to it. So within our 4-H camp settings and others where we are working with youth and providing education on healthy eating options, we cannot then go and serve them only sugary beverages because we're not reinforcing our message. So the next slide shows you an example from an adult event. So you click a couple times and we'll see some arrows that point to things. I just want to point out the sheer difference in volume between the cereal bars and the donuts. There are many more donuts than there are those Nutri-Grain bars there. And so this was an extension sponsored event, not in Tennessee, it was in a different state, but I would venture to guess that there may be similar situations where we have this imbalance of healthier options and then the less healthy option. So we have a role to play in helping to set those environments up so that people can make the best choices. And I will tell you also that that bowl of cereal bars was empty long before we had run to even the second row of those donuts. People wanted that. They chose that when it was available. So now I'm going to turn it over to Dr. Jarvandi.
Yes, thank you, Dr. Washburn. Good morning, everyone, and I hope that you are healthy and stay warm in this cold weather. Sorry that I have to keep my video off because of some technical issue today. So I would like to briefly talk about built environment and physical activity. Next, please. So I start with questions. Sorry, it says questions, but I deleted other questions just because of the time. It's only one question. Which of the following is part of the built environment? neighborhoods, park or recreation areas, transportation, highways. Just I give you a few seconds to think about it. Okay, next, please. Next slide, please. So when we want to talk about built environment, I think the first question is that what is built environment? We use this terminology, but it's good to first know the meaning of this terminology. Next, please. And the next one. Okay. So there are several definitions for built environment. I just chose here one simple and I think very comprehensive definition, that built environment is the human-made space in which people live, work, and recreate on a day-to-day basis. So I'm sorry, the previous one, please. Yeah. So it includes different components from buildings, parks, bikeability, walkability, even agriculture system, community garden, food access, transportation, all indoor and outdoor spaces, all are part of our built environment. Next, please. So now let's just see some examples, some pictures of the built environment and see their impact on our health. This is one example of a traffic with, that if we are there, we have to spend a large amount of time there. So what would be the impact of this on our health? Some answers are, of course, air pollution. And if we travel there, we have less time for physical activity, more sitting time, and even maybe more stress because of driving. And the potential for car accidents and injury also. Next, please. This one, maybe this picture is just, it looks more familiar to many of us, that in our neighborhoods, when we walk, we see a sidewalk, but that ends. And especially when I go and travel to new areas and I'm not familiar, I start walking in a sidewalk and the sidewalk ends. So what do we see with observing this area? Can we walk there? I think the most important thing in our observation is that when we look at this area for walking, we need to consider health for all, not just for ourselves, not for our age group or our own health condition, but for everyone. Can older people walk there? Is this safe for them? How about children? How about those with wheelchair? So as you see, there is a risk of falling there and then going to the road, risk of accident. So the most important consideration for physical activity is safety. Number one is safety, and we see here is not a safe place to walk. Next one, please. So as you see, I mainly talk about walking. Why walking? Because walking is something that everyone can do, and it's promoted by the Surgeon General here as part of Step It Up. It's not something new. It's the campaign that was released in 2015 to action. It's a call to action to promote walking and walkable communities. As you see, it has two components, walking and walkable communities. As we all know the benefits of walking, but something that I really like is that walking benefits community because of the interaction between communities. So it has some impact and benefit beyond general health and physical activity. Next one, please. So what kind of intervention we can do to do that based on the Step It Up? It's a combination of walking and built environment. So strategies to target not only individual and social environment, but also built environment. For example, for different programs that you have, for walking programs like Walk Across Tennessee, that you target already the individual and social environment. And then you can add some built environment component to that I will talk about that later. Next, please. So in these slides, you just see very brief some walkability features that they are important for healthy community design. The first one is destination, that there should be different destination within walking or biking distance, or in some places maybe with public transport, that people, they can go to those destinations. And maybe another terminology which is important, it's mixed use, that you can go like in this area on the picture, you can go there maybe to a bank and then a coffee shop and maybe walking to a school. So the terminology of destination is very important. We all have seen some sidewalk in the middle of nowhere, and no one is going to use that. So walking should be part of the daily activity to go to our destination. So one of the first steps is to identify destination. That might be church, school, or any other location. But these destinations, that might be a challenge in rural areas, that the different destinations are far from each other. Next, please. The other feature is that these destinations needs to be connected. It's the network of these destinations by either sidewalk or a trail. Again, we see sometimes there are destinations maybe half a mile from us, but there is no connection. We cannot walk there because there is no safe sidewalk or trail to get there. The next one, please. And something that I love it is just that when we want to walk somewhere, it's very important to see, is this safe? And also, how about the functional site design? Is it beautiful? If you walk or bike there, is it rewarding for us? Or is, if we walk in some areas, is more like a punishment to walk there and not using car? Next, please. So how we put this in practice? Just I put one example that we created for a few years ago for March, which was the extension month, to promote walking and to add, maybe in addition to a program for promote walking like Walk Across Tennessee, you can start with creating walking map. We created this around Morgan Hall to identify, for example, it's half a mile walk, takes 10 minutes. And we identify that based on the walking features, that the area that has sidewalk and has a good view and it's good for walking. And in that publication, you can see details about how to create this map. Even there is a short video, YouTube video, that you can see how to create this map, this simple one, and also with Google Earth. Next one. And then finally, when you identify your walking routes, you can add some signages and some motivational messages. We had some messages even for indoor area, inside Morgan Hall, or outside. There are a variety of messages that you can use and add to your program. Thank you, Dr. Sneed. I turn it back to you.
Thank you so much, Dr. Washburn, Dr. Jarvandi. This was great. Does anyone have any questions they'd like to put in the text chat? We have just a few minutes if there's some questions that you'd like to get answered about what was presented or about health programs. And I see we maybe have a question. Thank you, Lauren. Great information indeed. Any other questions or comments for the text chat? Okay, Dr. Jarvandi, Whitney asked, where is the resource for creating the walking maps?
That's the extension publication available. I'm happy to send that maybe to you when you send to everyone, but that is available online on our website.
Great, great. If you'll send it to myself or Dr. Washburn, we'll make sure to get that out. Nancy Rutker, way down in Hamilton County, wants to know, Dr. Washburn, I think this is for you. Are there grants for schools to get drinking fountains or drinking stations rather?
You know, when I first came to Tennessee, I visited some locations where they had gotten some grant funding, I believe from some grants through the Tennessee Department of Health, and they had been used for those water refill stations in schools. I'll need to look and see about availability now, because that could be a great resource for you. And there's a comment here from Barnes about good in suburban and urban areas and harder in rural areas, and that is absolutely the case. So most
They're
of
doing
the
updates now.
of doing this
I'm not
work
order to hear that.
are in need of some success stories from rural areas and adaptations that made things work there.
Awesome. And Shelley says April Martin has done an excellent job in securing funding for playgrounds in rural areas. So has our health council. Great. And Donna says the Project Diabetes grant from the Tennessee Department of Health provides many grants as well. M-A-N-Y, many grants. Fantastic. Anything else to share? All right, thank you to our speakers, and let's move on to association news and general updates. Does anybody have any association news from any of our professional groups? Just go ahead and unmute yourself and speak.
Good morning, this is Tennille Short. Just a reminder, if you have not already registered for the state TEA FCS conference, even if you registered last year, you will need to register again. So see the information that's been coming out about that. The information is on the association website because some of the information has been updated. So even if you've already registered last year, you'll need to register again for this year. If your payment is still there, you're good on that, but we will need you to register once again and hope to see as many people as possible in Memphis in April.
Thank you, Tennille, and thank you all in the Western region for working so hard. Tennille, we do have a question from Shelley. Are you all considering any type of virtual option? Not to put you on the spot, Tennille.
Well, we would love to be able to do that, but the truth of the matter is we have some financial obligations to the hotel. And if we did virtual and a lot of people chose virtual, then we would still be in a bad position. We realize this is not the best time to do a face-to-face conference, but there are some financial stipulations that are going on as far as having the conference. It's been rescheduled a couple of times, and we're on the hook for a block of rooms and food and things like that. So we do not plan to have a virtual option.
Makes total sense. Thank you, Tennille.
Hey, I'm going to chime in with Tennille. This is Katie. Please make note that by March the 5th is when we need most people registered, so we can kind of see where we stand. So please, if you have not, please try to do that by March the 5th so we can evaluate where we stand and all that kind of good stuff. So thanks. And we're trying our hardest to make it safe for everyone. So thanks to Tennille and Kane and all the subcommittee members. We're doing our best to make it safe for everyone to come. So thanks.
Thank you, Katie. Appreciate that reminder on that date. Any other news from either ESP, TEA 4HW, or any other group?
Chris, I see a question about UT vans to travel to the conference. There was some guidance that was sent out with the conference registration in terms of the coronavirus guidance. And it's recommended that you travel alone if you can't travel alone with one other person. So I don't know that vans are going to be an option for this, because it's kind of like the buddy system. You're asked to travel with the person that you're going to room with, if you're going to room with somebody, and all of these regulations so that we can follow the CDC guidelines as closely as possible.
Fantastic. Thanks.
Hey, Dr. Sneed, in the Eastern region, I've been working with David Perrin on that through some UT stuff as well. And I'm going to send out an email because I've been working on that since last February when we were planning to go last year. So Connie, I'll send something out this week about that to the Eastern region.
Thank you, Justin. All right. Let's see, other updates. Dr. Washburn, it looked like you were unmuting for something, I think.
Yeah, I do have a reminder for everyone. Thanks to those who participated in the January webinar focused on opioids through our Prompts 10 project. The next session is next week. It's Wednesday, February 24th. So please sign up for that if you'd like to attend. You can sign up and watch the recording from the January session at on our web page. It's prompt.tennessee.edu.
Fantastic.
This month's focus is on adolescent substance misuse, so there should be something for everyone.
Great. Thanks, Dr. Washburn. Other updates or association news?
Hey, Chris, this is Joy.
Hey, Joy.
I'm the vice president with the awards and recognition. I was just going to give a big shout out. We had over 50 award submissions. So I thought that was awesome. So I was just going to give a shout out to our peers across the state for submitting.
That's fantastic. That means there's competition for those of us that submitted this year. That's a good thing. That's awesome. Dr. Washburn, there's a question for you in the text chat wanting to know, oh, you've already answered it. You're way ahead of me. I tell you, it's hard to do two things at once here. To run a slide set and monitor a chat is this is a special skill set. Any other news or updates? Well, I'd like to take this time to give a shout out to our new Eastern Region FCS program leader. So congratulations, Mr. Thomas. We're very glad to have you in that position and welcome you. And so congratulations, Justin.
Thank you, sir. I appreciate it.
Absolutely. All right, other announcements, requests, questions, comments, complaints, anything else? Indeed, congrats, Justin. All right, hearing none. Next month, we're excited to welcome Dr. Burney and Dr. Johnson. They will be presenting about the Dietary Guidelines, understanding the how behind the why of the Dietary Guidelines. So you'll want to be sure to join us on March the 18th. And after that, I would point out, you all, it is hard to believe, but we will only have 2 other FCS Connect sessions scheduled. On April 15th will be our creative content team led by Karen Sargent. And then on the 20th, Dr. Washburn and I will wrap everything up. And of course, we're going to take the summer off to give us all a summer break. And we'll be looking at those evaluations very closely and hopefully be able to plan more of these events in the future.